So if you're preparing for the MSRA clinical paper, have a look at this example question. So while you select your answer, just a quick reminder, the bit of technique in this question is this is what we call a negatively framed question. Now, the majority of questions in the MSRA are positively framed. It will ask you what is an appropriate treatment, how would you treat this patient, what test would you do, what is the likely diagnosis. You can get some questions which are negatively framed, and it's easy to miss if you're not reading carefully. So you've got this patient terminally ill, metastatic cancer. The symptom they've got is severe nausea and vomiting. And the nurse suggests, maybe a syringe driver might help because you can put different things in there, including things to help with the nausea and vomiting. But look what the question's asking. It's not asking what would help. It's asking which of the following would be least helpful in alleviating the symptoms of severe nausea and vomiting. I.e., what would you not give this patient for this particular indication, rather than what would you give? Now, if you miss this negative word, you might be in a rush and you're just reading this and you think, oh yeah, syringe driver, yeah, I had a patient like this and they were really vomiting badly, and we gave them some dexamethasone and it really helped. And we do use that sometimes. Before I was a GP, I worked in palliative care. And dexamethasone can be helpful in some patients, or cyclizine can be, or haloperidol can be, or levomepromazine can be mixed in with things like, diamorphine. So you've got something for pain relief, something to help with their nausea and vomiting. So the correct answer is B. Hyoscine hydrobromide can be used in a palliative care setting, but it's used to clear respiratory secretions or to help with bowel colic, not for nausea and vomiting. So do you see, all of the others may be of some help depending on the specifics. For example, it says metastatic. When might dexamethasone be particularly useful? If someone had Met swear, think about a cause in that kind of context of severe vomiting. Yeah, someone with brain mets, okay? It can be really helpful in that situation. Okay, but hyoscine hydrobromide, it can be used, but it's used for these things, not for severe nausea and vomiting. So do you see, this would be the least helpful in alleviating his symptoms, not just least helpful, full stop, but in the symptoms that he's got. Now, if you miss that it was negatively framed, it's easy to have the knowledge and still lose a mark. Do you see? So reading carefully, understanding and picking up keywords is part of the technique. So if you found that helpful, this clip was taken from our MSRA Masterclass webinar. You can watch the 75+ minute recording to cover lots of questions and boost your preparation. I'll pop the link down below.